Teachers are concerned about heading back to school soon as COVID-19 is still spreading in the Austin area, and some parents are also worried about their kids. Here to talk about the state's response to the pandemic is Governor Greg Abbott. Thank you so much for joining us.
Oh, my pleasure. Thank you.
Governor, what would you like to say to teachers and parents who are concerned about in-person classes?
So the key focal point in going back to school has been the health and safety of students, teachers, and parents, as well as flexibility, knowing that school districts have the flexible option to choose when they want to open schools and how they want to open schools. I want to say how I mean that they can open up either within classroom learning or remote learning for up to 8 weeks if at all possible. And then even after those 8 weeks, they can get a waiver from the TEA if there is still a spread of COVID-19 in the area. And then in addition to that, if kids return to school and there's anybody who tests positive for COVID-19, there is a possibility of closing down the school for sanitizing purposes while children learn remotely online. Bottom line is we want to make sure children are educated, and we have the tools and strategies to make sure they can get educated in the safest environment possible.
And last week you stated that local health authorities do not have the authority to preemptively shut down schools, that they can only shut down schools if there is an outbreak. Why shouldn't proactive public health decisions be made by local health authorities?
Sometimes you want them to be proactive, but you cannot preemptively make a decision that is basically 3 months in advance, because no one has the capability of knowing what the status of COVID-19 is going to be 3 months from now. The reason why I'm using 3 months, of course, is because, as I just mentioned, schools have the capability of opening up remotely now and doing so for a total of 8 weeks before there's even the possibility that they would be required to have in-classroom education taking place. And these public health authorities, they can provide advice that the local school districts can rely upon and choose to follow that advice if that is their choice. Then on top of that, during the course of the school year, if it is learned that there is an outbreak in any particular school, those local health authorities still have the ability to order a school closure if that is the appropriate course that needs to be taken.
So there is leeway here. Now, a lot of the decisions about whether to reopen schools for in-person learning is being done through online meetings like Zoom for safety reasons. So would it be fair to send students and teachers back to classes if at that time these meetings are still not being held in person?
So understand this, and that is, again, if these meetings are having to take place by Zoom because conditions are considered to be unsafe, you would think perhaps that the superintendent would suggest that the safe way to open schools at that particular time is through that same remote process. Every superintendent in the state of Texas has the latitude as we speak right now to make several decisions. One, when schools open. It can be in August, or they can delay it until September or even later before they even open schools. And then two, when they do open, those same superintendents have the authority to decide that they will open up in remote-only mode so that they will provide education to students online. And that process can continue for at least 8 weeks before even asking for a waiver from the TEA.
Now, there is also some concern about kids with special needs or those without at-home access to technology falling behind in their education while remote learning. What help is available from the state to get technology to districts who are not able to reopen quickly and safely?
So the state has worked with local school districts, and altogether we've put in about $400 million to improve access to online learning. Part of it is closing the digital divide. Part of it is providing devices such as a million laptops. Part of it is providing hotspots. Part of it is working with the internet providers to make sure that all the tools and strategies will be in place for the remote learning that is needed. However, you did mention special needs students. I must emphasize for your audience that the local public health authorities suggested that if schools must open up online, schools can consider having special needs students in a classroom, knowing that that would be a far better setting for them in that situation.
All right, we are nearing the end of our newscast. Governor Abbott, thank you so much for sharing your time with us tonight.
Thank you all and be safe.